Kojo, would you like me to do session 2?
Go for it.
All right, Nancy Davidson here to talk about session 2, which I had the honor of chairing along with Kojo. We had, and maybe we could go back one slide, I think that, thank you. We had the honor of chairing a session that had multiple speakers who spoke about this situation from an academic perspective, an industry perspective, and then in 2 sort of systems where we thought that there was already a lot of integration where we might be able to learn from them. Now, one of the things you're going to see, not surprisingly, is there are some common themes between sessions. And so some of the things I'm going to talk about echo very much what Hetty just talked to us about. So I would say the most common slide that was shown in our session was one of a silo. And so it was pretty clear that a common theme was the need for integrated activity to eliminate silos, very much a common theme. And again, across all constituencies, both all of the academic groups abroad and in the US and across industry. And there are a lot of things that are wrapped up in that. First of all, the need to really manage and communicate results, as we've just talked about. Second, reinforcing what Hetty talked about, that the notion that the billing systems, they have to reward patient benefit, not sort of piecemeal work, if you will. Third, the notion of having incentive alignment between all stakeholders, and that does include the payers. And then fourth, making sure that we're really focusing on cost effectiveness models. And I would take that even further and say that we want to focus not only on cost and effectiveness, but value. I think a second important theme that came out is that hopefully the people who are going to be having this session 25 years from now at the National Academies will be different than us, that will have been able to train a new generation of integrated practitioners, people who are going to be looking at these things in an integrated fashion that we can't even really begin to imagine, but where we have to set up the systems to make sure that they emerge. And then finally, I think we also felt that we needed to do an even deeper dive into some of the integrated systems that already exist in the United States, things like the VA system that we heard about from Gil, or the work we heard about from Atul about what's going on at University of California Health. And I at least was particularly struck by his description of, how the problem of COVID really galvanized their system. And in a very short period of time, in the face of a great need, they were able to do a ton of integration. Now, I would point out a couple of things. First of all, during the time of COVID, we did lose over 1 million Americans. That's terrible. During the same time, we lost more than 1 million cancer patients. And so that really ought to be the same sort of incentive to us to galvanize that we felt at the time of COVID. Now, cancers are obviously a lot more complicated than COVID in some ways, but I think there are some lessons learned that we should take forward. Can I have the next slide? A variety of, now you can go back one, please. Your screen and there we go, the opportunities. There are a variety of them that we could think about. And of course, we'll have to think about how to prioritize as we come out with the key elements from this particular workshop. But things that we thought were covered and which were important for us to consider, and again, in some cases already touched on by Hetty, the need for structured reporting to facilitate a horizontally integrated and curated multimodal inputs. The second, although you talked about the fact, Hetty, that decision support wasn't the only thing here, that would be useful to have diagnostic decision support systems. Third, we're going to hear this in every single session, I'm sure, the need for patient centricity. At the end of the day, it is all about the patients and what's going to be needed in order to make their situation better. The opportunities for self-supervised learning from artificial intelligence, the need for ticket closure and feedback loops, and also thinking about measuring these things in real time. It's not just one single static evaluation. In diseases like cancer, we're going to have to look at things over a period of time in order to really be able to capture all of the value. And then finally, as I have already mentioned, the opportunity of trying to reinvent training so that we would have a new type of specialist in integrated diagnostics going forward. Thank you so much, Kojo. I know you're in the room, and I wonder if you'd like to add anything to this.
You covered it all. Thank you very much, Nancy.